Welcome to A Brief Paws, a pet podcast where we talk about all things pet related. This is our special season, with the entire season being an amazing conversation with the famous Dr. Faver, who is a top dermatologist and international speaker. This first episode is titled, Can Groomers Practice Veterinary Medicine? What does that mean? It means that groomers sometimes do some things that edge the line, right, between veterinary medicine and aesthetic grooming, I guess you would say. So we get into it with a veterinarian, Dr. Faver, and talk about what is appropriate and what is not. Let's get into it. Yeah, as a groomer, if you're practicing veterinary medicine, that's on you. And so I make that really clear with my groomers. No matter how you were raised in the groom shops to do X, Y, and Z, here's our policy and here's why. But one of the services that I like to add to my business, again, to just further this narrative, is that Dr. Lisa Littman. This is initially how we met. We met professionally in this way. And she's on sort of our team, or how, runs parallel with us. I don't know how you partnered up with us, teamed up with us, where she's on call for us at all times. Obviously, that doesn't mean she can come to us and stop a bleeding weird injury, right? Which luckily we don't have. On call means if I see something strange on the skin or this or that, or the customer has a weird question, or we just see something funky, that I can get her telemedicine opinion on what could it be. Obviously, she doesn't do a lot of full diagnosing over the phone like anywhere else, but she will allow me to take a picture, send it to her. She will respond, give some information. And then the biggest thing of all is tell the person whether or not this needs to be seen and whether or not it needs to be seen emergency, right? So that gets me out of, like, in the past, when I had my groom shop, even though we were really close with veterinarians, without having one on the phone like that and camera phones, because this was 2002, right. It was like, yeah, I see this weird bump. It could be this, it could be that. And you give them a little rundown of what it could or couldn't be. And that's about all you can do, but you can't diagnose, you can't say anything. Even if you've seen it 1,000 times and this is sebaceous cyst, that's not for you to say. So now I get to say, I don't even have to worry about that, because I would rather show off that I have Dr. Lisa in my pocket, within reason of not bothering her, but just saying, like, here, this looks like some of these things I've seen, but let's ask Dr. Lisa, just constantly furthering and pushing that narrative of, like, we ask a vet questions, and we ask a groomer questions. Right. And so I don't care if I've seen it 1,000,000 times. If the customer wants to know and is interested, we ask Dr. Lisa, what should we use for that? Well, let's ask Dr. Lisa, like, really understanding that's a vet question. Of course, groomers should know a lot about skin and things like that, but there's still a boundary there of that sort of thing. And with the ears and the anal glands, I was raised to do that. The first groom shops, it was every dog got their ears plucked. Luckily back then it wasn't anal glands on every dog, but there was other shops that did that. And now we're completely the opposite. And so we've done a video, one on anal glands, one on ear plucking, that explains that with the veterinarian, because otherwise people think that we're lazy or we don't know how to do it, or, because they've heard that you're supposed to do it. Right. So.
Yeah. And the problem is that kind of stuff's really not taught in a lot of the schools. And the school of hard knocks, a lot of times you get somebody that's been doing it for 20 years and, liabilities have changed greatly in those 20 years on that. And I'm going to say most groomers, whether they know or not, are practicing medicine from time to time. Because all you have to say is, here, your dog has an ear infection, here's some Zymox and here's my bill for grooming. And you've met the 3 criteria for practicing medicine. Or, your dog's got an allergy. I recommend that you go on raw diet, and here's my bill for grooming. It's diagnose, treating, and charging a fee. They say, well, I charge for my grooming. In court of law, prove it. Prove it.
That's a really good point. How do you know what your vet should do and what your groomer should do? And when is your groomer practicing medicine? And when is that okay or not okay? I mean, you just kind of explained somewhat of what that is. Maybe we could have a longer list of exactly what type of things that is. Plucking the hair out of the ear canal is a big one. Anal glands is a really big one. One I would say that is very tempting for many groomers to do, and I see a lot of them do it, but I think that that's a big gray area, is popping cysts.
Mhm.
and extracting cysts kind of things, because I know a lot of them find it really fun to, Dr. Pimple Popper, and oftentimes feel like it can be really harmless. Can you elaborate on why that may not always be the best thing to do, or why that would be practicing medicine?
Well, a couple of different things. Let's just talk about the science of what you're doing there. Is if you have a cyst, you basically have a closed up follicle for whatever reason. And so usually it's dried sebum at the opening of the follicle, or it can be dried sebum at the opening to the sebaceous gland. So you have a plug and you're going to squeeze it. And that's kind of like squeezing a balloon. It's going to break someplace, but the question is it going to break in the right place? Because if you got a lot of inflammation in the skin and that's really tightly held there, you may rupture that cyst internally, and then you got those problems to deal with. The other thing is when you start squeezing a cyst, you're causing inflammation. Usually the problem starts off due to inflammation or overproduction. So you squeeze the cyst and you get the fun of watching it come out. But the reality is you've just created the exact same scenario that may make it worse or make it return on that. You haven't solved any problems. So, our approach to those is always, let's solve the problem. And the way you break down those plugs is oils dissolve oils, grease dissolves grease. So we use a close, open, close type technique, and use our conditioners to break that cyst up or liquefy it. And a lot of times it's really bad, we'll add extra oils in there. We like avocado oil, fairly inexpensive. You can go in there and do that. And then the other secret when you're doing that is you have to warm the body up, because a cold cyst is very tight. When you warm it up, it opens up. And that, by doing that, you allow your conditioner to get in deeper, but also I always say the cork falls out of the bottle, because if we no longer holding it in tight, then it will go ahead and release that. And, prime example that, a lot of people seen it are the hairless dogs. We do everything wrong with the hairless on that, in the fact that we use Pyoben and we use benzoyl peroxide and all that. They're all drying agents. And a lot of times they're shampooing and they're not even conditioning these dogs. So pretty soon you got boot leather and all these pimples because we've closed it up and dried it out. Where, a hairless dog really should be oiled daily. Because they're not producing, they don't have the hair for protection. They need that extra sebum for protection. So, by oiling them, and there again, we have Black Passion, which is really nice because it's got argan oil, which is very nutrient rich. But then we have people oil them daily with the argan oil, and it doesn't take a lot. It's just you don't want a greasy dog. You just want that extra protection on there, which also has UV and UVB protection. So if they are out in the sun, they're not sunburning, because that skin's pretty vulnerable. Even though they're bred that way, doesn't mean that that's a perfect system on that. So most hairless dogs are very poorly taken care of. But, we have a lot of our dogs that, like I say, cysts are a big problem. We fight them in certain breeds, like a lot of your terriers, they don't even bathe these dogs because they want that coarse coat. So what they end up doing is they just blow them out and comb them out and leave the dirt on, which sets them up for problems. And even things like blowing, if you get too close, you're actually a lot of times forcing that dirt into those follicles. And so you're just setting yourself up for disaster in the long run. And if you never take care of them, they're going to grow. And then because that's tight at the top, that cyst gets bigger and bigger and bigger. And the longer it stays, then you start getting scar tissue in there that even if you do exude it correctly with the oils and stuff, you still got that pocket that's going to want to fill up again. So it's kind of this vicious cycle that you get into. But squeezing them, I always say one of the biggest problems with all skin problems is inflammation. If you get the inflammation out there and replace the sebum, you can solve 99% of your skin problems on that. But it's just a question of what's the source and what caused it, and can we fix it or not? And veterinarians have a tendency, we are taught to treat from the inside out, where groomers treat from the outside in. And reality is the problem's on the outside of the barrier. So that's where groomers become probably the more important aspect of that, because I can give drugs that will cut down on the inflammatory process, but those drugs will do nothing for the surface of the skin. You can give all the Apoquil in the world, but it's not going to take care of that debris on the surface. It's not going to replace the sebum on that surface on that. And as soon as they add antibiotics, we just add more problems, because then, like with most women, antibiotics lead to yeast infections. And so now we got a yeast infection on the skin, we got a whole different problem. And if we use a harsh shampoo, even though it's good antibacterial, antifungal, you still got a harsh shampoo that irritates the skin. And there again, we've started that inflammatory process all over again. So.
Well, I'm glad you mentioned the cork out of the bottle thing, because I think groomers have experienced one of two things. Either they want to pop that cyst, or it pops on its own during the bath. And then sometimes you have to explain to the owner that you didn't do anything wrong. You was just giving a normal bath. Because sometimes it's followed with some dark fluid or some blood, and they get very concerned. And I understand, but you're like, I didn't even touch it, that kind of thing. I do have a short anecdote about, there's a celebrity, and I don't want to say who they are, but New York City, you always get some of them, but they actually had their dog doing some acting or whatever you call that as well. And the dog, for a long time had it was a yellow lab, the very large cyst on the top of its head that had been there for a very long time. And finally, after seeing this dog, a number of years, at some point, just normal bathing and whatnot, not even the dryer or anything yet, it finally burst, and all that sort of thing. You get rid of all of it. So by the time she picks up, it looks totally different. It's gone. Her first concern was, oh my gosh, is that okay? Because that seems like a veterinary, event to happen.
Right.
But then she jokingly was like, I think joking and half joking, that like he was in the middle of filming something and now he looked totally different, because it was quite a large cyst on the top of the head, and that it was going to cause an issue when the dog's acting and whatnot. But you do get that where, like you said, the cork out of the bottle, sometimes you're just doing that and it comes out on its own. It's sometimes when they're elderly, they have these different types of them all over, and sometimes just one nice warm bath, and they are oozing and bleeding and stuff, and you have not done anything. You've not pulled off a scab. You've not injured the skin in any way. This is just what they're doing. And of course, if I didn't know any better as a customer, I'd be concerned as well, or think that you were too rough or that kind of thing. But yeah, it's stuff with the skin, besides doing what we should be doing product-wise. I think it's into sketchy territory for groomers. One of the other ones that I see that gets quite controversial has to do with the nails, and has to do with taking the quicks back on the nails. You see a lot of people saying, well, if you forcefully quick it, or if you grind it and get it back that way. I know a lot of show people and maybe breeders, they like those quicks down to little like nubs. There's really only one way to do that, unless you've started from a puppy and kept them really, really short. If you're trying to shorten a quick, the only way I've seen involves some sort of, trauma to the vein and the tissue. I feel like that gets into vet territory, and I always end up deferring to that, but I know some people are very comfortable doing that and think that it's perfectly within reason to do that within their professionalism. What do you feel as a veterinarian is the best way to go about that? And do you think it's practicing veterinary medicine?
Well, I think a fine line, at the end of the day, we got to look at the health and well-being of the pet. And, if you're severely quicking a dog, that's painful. And so you're putting them through a lot of trauma. As a veterinarian, if I saw a need for it, because sometimes they grow so long that you can't even trim the tips without causing a problem. And especially on old dogs that are arthritic, they're turning them under and breaking toes and doing all sorts of things. So you get into something like that, then I always recommend let's sedate them and do a surgical type nail trim. So you're not traumatizing the animal on that. Because there again, if you're going to have to do nail trims on this dog in the future and you traumatize him, that's going to be a bad experience and he's not going to want to do it again. On that, you have to remember the bloodline goes out, but so does the nerve sensation on that. So they're feeling that. So it's not just about stopping the blood. The other thing you have to remember, and I always caution clients when we did this, is in order to quick them, that means we're cutting that blood vessel at a larger area the farther we get into that nail. So we're going to have to cauterize it. So when you cauterize it, you use copper sulfate or silver nitrate or whatever, you're cauterizing it, but you're also sealing it. And so if there's any chance that there's an infection or problem in there, you potentially can create a really nasty infection in those nail beds. And so you have to be very, very cautious of that. And, I always tell groomers, it's about risk management. And you may get away with that, and you may have done it 100 times, but the 101th time you do it and it goes wrong, that can be a big, big issue. The good news is the legal community hasn't gone after groomers and veterinarians as much as potentially we're liable for some of those kind of things, but it's coming. And so you never know when the next shoe's going to drop where you have a case like that, and all of a sudden you're into big financial issues and losing your salon and big things, because a lot of times your insurance won't cover those kind of things because you're not really licensed for it. Like you say, that's on a gray area between veterinarian and groomer. So it's all about what the lawyers, how they plead their case on that. So I'm always cautious on that.
Yeah. And I should mention, for those who don't know what we're talking about when we say the quick can grow out, there's a nail, a vein that grows inside the toenail, and it can grow with the nail at length for a while. And that might be when your groomer says that when they trim the nails, they can only trim it so far and they can still look quite long. It's because as you mentioned, the vessel and some nerves has grown with the nail to a certain extent. So just imagine if your fingernail was growing, but your finger grew with it. So that's why you can only take it back so far. So we're talking about shortening that, which is shortening the blood vessel and the nerves. Just to reiterate what that was.
There's also a bone in there too. So if you cut it back far enough, you can get into that bone. So that's also involved in the process.
Yeah, it's crazy. Some of them look very, very, very long, but you're right. And especially some of those little dogs, they grow just so quickly into a little curve and go right into the paw pad, and that really they're walking on them. It really needs to be taken back. But yeah, I personally always was sort of like, that's a vet thing. Let them do it when they're, can put them under or something. But I'm a super softie, and I don't like to hurt them in any way. Thanks for listening to A Brief Pause, and make sure to listen to the next episode to continue our conversation with Dr. Faver.